Welcome to SMCPT video lectures. We are discussing about manual muscle testing. So what are the objectives of this topic? Here we will be learning about the purpose of manual muscle testing. We also will know about the indications of manual muscle testing, its principles behind, and also we will be learning about the grading system or how to grade the strength of the muscles. So manual muscle testing, or also called as MMT, is a procedure for the evaluation of strength of individual muscle or muscle group based upon the effective performance of a movement in relation to the forces of gravity or manual resistance through the available range of motion. So basically, manual muscle testing is nothing but the procedure to know the strength or the level of strength of the muscle. So here another important point we need to remember is gravity and manual resistance. So this gravity also acts as a resistance to the muscle, and if muscle is able to perform against gravity or against manual resistance, it can be graded differently. And next important point we need to remember here is range of motion, which we will be discussing later. Another point I want to focus on is muscle group. So why we are measuring the strength of the individual muscle or muscle group? So some of the muscles cannot be differentiated in their functioning. For example, hamstring. Hamstring muscles create flexion of the knee. There are many hamstring muscles, so we cannot differentiate the function of those muscles. Every muscle performs as a flexor of the knee joint. So we can take those group of muscles as one unit and perform the manual muscle testing. So the sole purpose of manual muscle testing is to identify the level of strength or weakness of the muscle or group of muscle. We need to remember that we can use MMT effectively only for weak muscles and not for the normal muscle. This is because MMT is not so sensitive in differentiating between the normal muscles because small differences cannot be perceived by manual muscle testing, but big range of difference can be appreciated by using manual muscle testing. For example, if you're comparing a weak muscle with a normal muscle, you can clearly see the difference. So therefore, MMT is very effective in testing the weak muscles rather than the normal muscles. MMT also help us to know the prognosis of the patient's condition. For example, if patient had a weak hamstring muscle, the muscle strength was grade 2, and after 1 week we again examined using MMT the strength of the muscle, and it was still grade 2, so there was no improvement in that 1 week. So that is called as tracking the prognosis. So we know that manual muscle testing is used to see the level of weakness or strength of the muscle. So what are the conditions that causes weakness of the muscle? The most common cause for weakness of muscles is central nervous system damage. So there are various conditions which causes central nervous system damage, that is traumatic spinal cord injury, any accidents causing traumatic spinal cord injury, or brain injury. So if the motor areas of the brain or spinal cord is injured, then obviously there would be muscle weakness. Other conditions that can also cause muscle weakness are other conditions of central nervous system damage, that is stroke. Stroke is nothing but the rupture of the blood vessels inside the brain, causing bleeding and injury to the brain cells, or also it can be caused by the obstruction of the blood vessels supplying blood to the brain, causing ischemia and damage to the brain cells. So this is one of the common neurological condition causing muscle weakness. Sometimes if one side of the brain, that is one hemisphere, is injured, then the half of the body would go for weakness. That is also called as hemiplegia. So this is one of the common condition that we have to rehabilitate as a physical therapist. Next condition is cerebral palsy, mostly commonly seen in children. Other reasons for muscle weakness could be long-term immobilization of the patient. For example, if patient has gone for major surgery or traumatic fracture of pelvis, femur or tibia, then patient would be immobilized for a long period of time, causing muscle weakness or atrophy, precisely called as disuse atrophy because of immobilization. Uh, Atrophy, I hope you all are familiar with the term atrophy, which is nothing but reduction in the bulk or fibers of the muscle causing weakness due to immobilization or paralysis. Another cause for muscle weakness could be muscle injury or also called as muscle strain. So that is the particular muscle is injured, so therefore it is weak. So now summarizing the conditions that may require manual muscle testing or the indications for manual muscle testing are traumatic brain injury, traumatic spinal cord injury causing central nervous system damage, stroke, cerebral palsy, multiple sclerosis and muscular dystrophies are also some of the conditions that causes central nervous system damage, peripheral nerve injury, disc herniation, prolonged immobilization and strain as some of the conditions causing weakness, and it may require manual muscle testing. Just an observation, how can we know that the muscle could be weak? During observation, without even touching the patient or examining the patient, just by looking at the limbs or the structure of the patient, how can we say the muscle could be weak? Is by identifying the atrophy. So here you can see in the picture, the right limb looks smaller than the left limb. So most probably the right limb, the thigh muscles, has gone for atrophy. So why examining range of motion is important? First of all, let us know how can we find the full available range of motion. So we will be taking a hip joint as our example for understanding this. So to find the full range of motion of hip flexion, we would be performing passive range of motion. So you know what is passive range of motion? Passive range of motion is effort applied by the therapist, not by the patient. So passively, when we perform the movement of the hip joint, we will find normally 0 to 90 degree of range, that is full range of motion, if there is no restriction from the muscle tightness or the joint stiffness. If there is no joint stiffness and if there is no muscle tightness in a normal hip joint, passive range of motion would be 0 to 90 degree. Now if the muscles are weak, that is hip flexors, psoas major, iliacus are the hip flexors. If these muscles are weak, it may not complete the available full range of motion, which is normally 0 to 90 degree. So you can see in the picture, patient actively performs hip flexion and is able to complete only 60 degree. So 30 degree is the range which is not completed, and it could be because of muscle weakness. So therefore, range of motion is very important for assessing the level of muscle strength or while using manual muscle testing. We also need to remember that available range may not be always full, that is always normal. In case of muscle tightness, for example, you can see in this picture, the quadricep muscles are tight. Therefore, the therapist is trying to complete the passive range of motion of knee flexion, but because of the tight rectus femoris, patient is going for trick movement of flexion of hip, trying to reduce the stretch on the rectus femoris. Passive knee flexion is performed only till 90 degree. Beyond that, the rectus femoris is not allowing. So in this case, the full range of motion, available full range of motion would be 0 to 90 degree and not the normal full range of motion, which is 0 to 135 degree of knee flexion. And also in case of joint stiffness, we would be taking available range of motion which would be less than the normal range. So here is the picture which shows joint erosion, stiffness, and degeneration of the knee joint, which could cause reduction in range of motion passively. So, again, I would like to stress on the point that passive range of motion should be performed first to know the full range of or full available range of motion before performing MMT. Now, coming to grades of MMT, or to differentiate between the weakness or strength of the muscle, there are particular grades given by MRC, that is Medical Research Council, and the grades of manual muscle test are recorded based on the effort perceived by the muscle to complete the range of motion or active muscle contraction by the patient. Here again, we had discussed earlier that gravity is one of the important point here. Gravity is also a form of resistance that is basic to manual muscle testing, and it is used in tests of trunk, neck, and extremity muscles. Gravity may be insignificant for small joint muscles, for example, fingers and toes, where the muscle effort is far great than the weight of the bone. So the gravity effect on the bones would be insignificant. But for large extremities like hip joint, knee joint, etc., gravity plays an important role while assessing manual muscle testing. Medical Research Council scale of muscle strength uses a score from 0 to 5 to grade the power of the muscle group or muscle. We will be discussing one by one these grades and what does this grade signify. What does grade 5 mean? So we will be tagging the muscle as grade 5 if the muscle is able to perform full range of motion against maximal resistance, or also grade 5 is considered as a normal muscle strength. You can see in this diagram, the patient is trying to perform hip flexion to full range, that is 0 to 90 degree, and the therapist is applying resistance or full resistance, and patient is able to overcome that full resistance applied by the therapist and complete the full available range of motion. This would be considered as grade 5. Next, grade 4. When would we call a muscle grade 4? A muscle is tagged as grade 4 when the muscle is able to perform full range of motion against resistance but not maximal resistance. Patient is able to perform full range but not against maximal resistance, and then we will be grading it as grade 4. Grade 3, if the patient is able to perform full range of motion against gravity but not against resistance, then it will be tagged as grade 3 muscle strength. Again, I would like to repeat, patient is able to perform only against gravity but not against therapist resistance or any external resistance. And again, I would like to stress on the point, patient is able to perform full range of motion against gravity, and that would be tagged as grade 3, or also precisely full available range of motion. Coming to grade 2, now here it becomes quite tricky. Grade 3 means patient is able to perform against gravity but not against any resistance. Grade 2 means patient won't be able to perform against gravity. So what should we be doing? We should eliminate the gravity, or we should delete the gravity. So how can we eliminate the gravity? Grade 2 means muscle can perform full range of motion in eliminated gravity position. So when the gravity is removed, patient can perform full available range of motion. So we can eliminate the gravity by performing movements in horizontal plane. Example here. So to perform hip flexion in eliminated gravity position, we would ask the patient to lie in side lying position, and we can remove gravity by applying a suspension to the lower limb, or also we can support the lower limb and then ask the patient to perform the hip flexion. Grade 1. So grade 1 means there is no movement at the joint but the muscle. You can see some flickers of contraction or fasciculations at the muscle. You can refer to this animation here. uh, I didn't find any flicker of movement examples for hip flexors, so here we have example for gastrosoleus. When you ask the patient to perform plantar flexion, which is the function of gastrosoleus, you would perceive only flickers of movement or fasciculation. So this would be tagged as grade 1 muscle strength. And grade 0 means there is no movement at all. There is no flicker of movement observed. There is nothing. It is totally paralyzed. So that would be graded as grade 0 muscle strength. Uh, so how many grades we have discussed here? According to MRC grading, we have discussed 5 grades. So grade 5 means patient is able to perform full range of motion or full available range of motion against maximal resistance. Grade 4 means patient is able to perform full range of motion against minimal resistance, not maximal resistance. Grade 3 means patient is able to perform full range of motion against gravity. Grade 2, patient is able to perform full range of motion in eliminated gravity position. And grade 1, there is no movement at the joint but there is only flicker of contraction of the muscle. And grade 0, there is no movement, no flicker of contraction, it is totally paralyzed. So these were important points from manual muscle testing. And here we know that manual muscle testing requires a lot of basic knowledge like muscle insertion, function of the muscle, innervations, etc., and also goniometry, which is very important here. So we have to take the range of motion by goniometry and see if the patient is able to perform full range of motion or not. So therefore this basic knowledge we would be examining more or discussing more with you all. For now, you just revise on this topic and we'll get back again. Thank you.